NCELX Daily Practice. Part 3. 41. When interviewing the parents of a child with asthma, it is most important to assess the child's environment for what factor? A. Household pets. B. New furniture. C. Lead-based paint. D. Plants such as cactus. 41A. Household pets. Animal dander is a very common allergen affecting persons with asthma. Other triggers may include pollens, carpeting, and household dust. 42. The mother of a 2-month-old baby calls the nurse 2 days after the first DTaP, IPV, hepatitis B, and HIV immunizations. She reports that the baby feels very warm, cries inconsolably for as long as 3 hours, and has had several shaking spells. In addition to referring her to the emergency room, the nurse should document the reaction on the baby's record and expect which immunization to be most associated with the findings the infant is displaying. A. DTaP. B. Hepatitis B. C. Polio. D. H. Influenza. 42A. DTaP. The majority of reactions occur with the administration of the DTaP vaccination. Contradictions to giving repeat DTaP immunizations include the occurrence of severe side effects after a previous dose as well as signs of encephalopathy within 7 days of the immunization. 43. The mother of a 2-year-old hospitalized child asks the nurse's advice about the child screaming every time the mother gets ready to leave the hospital room. What is the best response by the nurse? A. I think you or your partner needs to stay with the child while in the hospital. B. Oh, that behavior will stop in a few days. C. Keep in mind that for the age, this is a normal response to being in the hospital. D. You might want to sneak out of the room once the child falls asleep. 43C. The protest phase of separation anxiety is a normal response for a child this age. In toddlers, ages 1 to 3, separation anxiety is at its peak. 44. A couple experienced the loss of a 7-month-old fetus. In planning for discharge, what should the nurse emphasize? A. To discuss feelings with each other and use support persons. B. To focus on the other healthy children and move through the loss. C. To seek causes for the fetal death and come to some safe conclusion. D. To plan for another pregnancy within 2 years and maintain physical health. 44A. To discuss feelings with each other and use support persons. To communicate in a therapeutic manner, the nurse's goal is to help the couple begin the grief process by suggesting they talk to each other, seek family, friends, and support groups to listen to their feelings. 45. The nurse is performing a pre-kindergarten physical on a 5-year-old. The last series of vaccines will be administered. What is the preferred site for injection by the nurse? A. Vastus intermedius. B. Gluteus maximus. C. Vastus lateralis. D. Dorsogluteoli. 45C. Vastus lateralis. Vastus lateralis, a large and well-developed muscle, is the preferred site since it is removed from major nerves and blood vessels. 46. A 7-month pregnant woman is admitted with complaints of painless vaginal bleeding over several hours. The nurse should prepare the client for an immediate A. Non-stress test. B. Abdominal ultrasound. C. Pelvic exam. D. X-ray of abdomen. 46B. Abdominal ultrasound. The standard for diagnosis of placenta previa, which is suggested in the client's history of painless bleeding, is abdominal ultrasound. 47. A nurse entering the room of a postpartum mother observes the baby lying at the edge of the bed while the woman sits in a chair. The mother states, "This is not my baby, and I do not want it." After repositioning the child safely, the nurse's best response is This is a common occurrence after birth, but you will come to accept the baby. B. Many women have postpartum blues and need some time to love the baby. C. What a beautiful baby. Her eyes are just like yours. D. You seem upset, tell me what the pregnancy and birth were like for you. 47D. you seem upset, tell me what the pregnancy and birth were like for you. A non-judgmental, open-ended response facilitates dialogue between the client and nurse. 48. The nurse notes that a 2-year-old child recovering from a tonsillectomy has a temperature of 98.2 degrees Fahrenheit at 8 a.m. At 10 a.m., the child's parent reports that the child feels very warm to touch. The first action by the nurse should be to a. Reassure the parent that this is normal. B. Offer the child cold oral fluids. C. Reassess the child's temperature. D. Administer the prescribed acetaminophen. 48C. Reassess the child's temperature. A child's temperature may have rapid fluctuations. The nurse should listen to and show respect for what parents say. Parental caretakers are often quite sensitive to variations in their children's condition that may not be immediately evident to others. 49. The nurse is caring for a client who was successfully resuscitated from a pulseless dysrhythmia. Which of the following assessments is critical for the nurse to include in the plan of care? A. Hourly urine output. B. White blood count. C. Blood glucose every 4 hours. D. Temperature every 2 hours. 49A. Hourly urine output. Clients who have had an episode of decreased glomerular perfusion are at risk for pre-renal failure. This is caused by any abnormal decline in kidney perfusion that reduces glomerular perfusion. Pre-renal failure occurs when the effective arterial blood volume falls. Examples of this phenomena include a drop in circulating blood volume as in a cardiac arrest state or in low cardiac perfusion states such as congestive heart failure associated with a cardiomyopathy. Close observation of hourly urinary output is necessary for early detection of this condition. 50. A client is admitted to the rehabilitation unit following a cerebrovascular accident, CVA, and mild dysphagia. The most appropriate intervention for this client is to A. Position client in upright position while eating. B. Place client on a clear liquid diet. C. Tilt head back to facilitate swallowing reflex. D. Offer finger foods such as crackers or pretzels. 50A. Position client in upright position while eating. An upright position facilitates proper chewing and swallowing. 51. A 72-year-old client with osteomyelitis requires a 6-week course of intravenous antibiotics. In planning for home care, what is the most important action by the nurse? A. Investigating the client's insurance coverage for home for antibiotic therapy. B. Determining if there are adequate hand-washing facilities in the home. C. Assessing the client's ability to participate in self-care and/or the reliability of a caregiver. D. Selecting the appropriate venous access device. 51C. Assessing the client's ability to participate in self-care and/or the reliability of a caregiver. The cognitive ability of the client as well as the availability and reliability of a caregiver must be assessed to determine if home care is a feasible option. 52. A nurse administers the influenza vaccine to a client in a clinic. Within 15 minutes after the immunization was given, the client complains of itchy and watery eyes, increased anxiety, and difficulty breathing. The nurse expects that the first action in the sequence of care for this client will be to A. Maintain the airway. B. Administer epinephrine 1:1000 as ordered. C. Monitor for hypotension with shock. D. Administer diphenhydramine as ordered. 52B. Administer epinephrine 1:1000 as ordered. All the answers are correct given the circumstances, but the priority is to administer the epinephrine, then maintain the airway. In the early stages of anaphylaxis, when the patient has not lost consciousness and is normotensive, administering the epinephrine is first, and applying the oxygen, and watching for hypotension and shock, are later responses. The prevention of a severe crisis is maintained by using diphenhydramine. 53. The nurse instructs the client taking dexamethasone, Decadron, to take it with food or milk. The physiological basis for this instruction is that the medication A. Retards pepsin production. B. Stimulates hydrochloric acid production. C. Slows stomach emptying time. D. Decreases production of hydrochloric acid. 53B. Stimulates hydrochloric acid production. Decadron increases the production of hydrochloric acid, which may cause gastrointestinal ulcers. 54. A client receiving chlorpromazine HCl, thorazine, is in psychiatric home care. During a home visit, the nurse observes the client smacking her lips alternately with grinding her teeth. The nurse recognizes this assessment finding as what? A. Dystonia. B. Akathisia. C. Bradydyskinesia. D. Tardive dyskinesia. 54D. Tardive dyskinesia. Signs of tardive dyskinesia include smacking lips, grinding of teeth, and fly-catching tongue movements. These findings are often described as Parkinsonian. 55. Which of the following findings contraindicate the use of haloperidol, Haldol, and warrant withholding the dose? A. Drowsiness, lethargy, and inactivity. B. Dry mouth, nasal congestion, and blurred vision. C. Rash, blood dyscrasias, severe depression. D. Hyperglycemia, weight gain, and edema. 55C. Rash, blood dyscrasias, severe depression. Rash and blood dyscrasias are side effects of antipsychotic drugs. A history of severe depression is a contraindication to the use of neuroleptics. 56. The nurse is reinforcing teaching to a 24-year-old woman receiving Acyclovir, Xovirex, for a herpes simplex virus type 2 infection. Which of these instructions should the nurse give the client? A. Complete the entire course of the medication for an effective cure. B. Begin treatment with Acyclovir at the onset of symptoms of recurrence. C. Stop treatment if she thinks she may be pregnant to prevent birth defects. D. Continue to take prophylactic doses for at least 5 years after the diagnosis. 56B. Begin treatment with Acyclovir at the onset of symptoms of recurrence. When the client is aware of early symptoms, such as pain, itching, or tingling, treatment is very effective. Medications for herpes simplex do not cure the disease, they simply decrease the level of symptoms. 57. A 14-month-old child ingested half a bottle of aspirin tablets. Which of the following would the nurse expect to see in the child? A. Hypothermia. B. Edema. C. Dyspnea. D. Epistaxis. 57D. Epistaxis. A large dose of aspirin inhibits prothrombin formation and lowers platelet levels. With an overdose, clotting time is prolonged. 58. An 80-year-old client on digitalis, Lanoxin, reports nausea, vomiting, abdominal cramps, and halo vision. Which of the following laboratory results should the nurse analyze first? A. Potassium levels. B. Blood pH. C. Magnesium levels. D. Blood urea nitrogen. 58A. Potassium levels. The most common cause of digitalis toxicity is a low potassium level. Clients must be taught that it is important to have adequate potassium intake, especially if taking diuretics that enhance the loss of potassium while they are taking digitalis. 59. 42-year-old male client refuses to take propranolol, hydrochloride, Inderal, as prescribed. Which client statement from the assessment data is likely to explain his non-compliance? A. I have problems with diarrhea. B. I have difficulty falling asleep. C. I have diminished sexual function. D. I often feel jittery. 59C. I have diminished sexual function. Inderal, a beta-blocking agent used in hypertension, prohibits the release of epinephrine into the cells. This may result in hypotension, which results in decreased libido and impotence. 60. The nurse caring for a 9-year-old child with a fractured femur is told that a medication error occurred. The child received twice the ordered dose of morphine an hour ago. Which nursing diagnosis is a priority at this time? A. Risk for fluid volume deficit related to morphine overdose. B. Decreased gastrointestinal mobility related to mucosal irritation. C. Ineffective breathing patterns related to central nervous system depression. D. Altered nutrition related to inability to control nausea and vomiting. 60C. Ineffective breathing patterns related to central nervous system depression. Respiratory depression is a life-threatening risk in this overdose.